Hello, and welcome to The Public's Health, the show that puts you, the public, back into public health. I'm Dr. Tony Iton, and I'm the director of the Alameda County Public Health Department. Today I've invited you into my office because in some ways we're celebrating 2 years of being on the air. We've done over 20 shows profiling public health around Alameda County in many different ways. We've looked at subjects as diverse as pandemic influenza and emergency preparedness. We've also talked about HIV, tuberculosis, child safety, nutrition, senior safety, and recently we did an interesting show looking at asthma and diesel truck emissions at the Port of Oakland and its impact on the citizens of West Oakland. And we think that these shows give you an important sense of the complexity and diversity of public health. For the next 10 shows, we hope to get input from you about those things that you consider to be important, the things that are most pressing to you that you think the Public Health Department should be working on. We really want to put you in the driver's seat so you can call us and say, hey, why don't you do a show on this? This is important to me. You're going to see essentially an excerpt of our past 10 shows, and we hope that you enjoy it. Stay tuned.
And now, another episode of Pandemic Detective. Today's episode finds the investigator on the Oakland waterfront.
The suspect in this case is Vi, the virus. Let me dish out the facts. She's small and very dangerous. She travels around the world now and then. She likes birds. She might learn to like you. I'm watching for her. The health department's watching. If Vi the virus shows her ugly mug, we'll be ready. So cover your cough, wash your hands, and keep your eye on Vi the virus.
Brought to you by the Alameda County Public Health Department.
Avian influenza, or bird flu, has killed people in various countries around the world.
Even if the pandemic starts overseas, it is going to start to affect us here in the United States. Say, for example, your company has a key supplier that manufactures their goods overseas, and that company may be impacted by what's happening in that other country, and you're no longer able to get those critical manufacturing parts into your supply chain.
Now, this post office has glass barriers between the customers and the Postal Service staff, but not all post offices are like that. So what are you telling your employees that work at those more open post offices?
What we're going to do for those employees is if you as the health department tell us there's a possibility of a local infection, we're going to offer them a couple things. One is masks, the other is gloves.
The flu bug is spread in what we call respiratory droplets. And these respiratory droplets are produced when we cough, sneeze, or even talk as we are doing now. So the name of the game is to not inhale respiratory droplets from someone who actually has the flu bug.
You need to get food.
Environmental health has a number of inspectors, and each inspector has a specific district that they inspect in. We look at retail food in the county, so that means food that is served to the final person who consumes it. And we go out to these facilities 1, 2, 3, sometimes 4 times a year.
Many retail companies already have contingency plans in place. The food industry has a long history of dealing with natural disasters, man-made disasters. So the core of a contingency plan is in place. It's just tweaking it to this specific disaster. So overall, I would say that the grocery industry is in good shape.
Actually, it's very easy, simple, and affordable. Some steps you can take to prepare for your family in case of a pandemic. The number one thing to stockpile is water. We recommend that you do 1 gallon per person per day with a minimum of 5 days. If you can store more, by all means, store more water. Once you have that down, you can start thinking about some protein items. Canned goods have a really long shelf life, so your canned tuna, your canned ham, chicken, peanut butter's nice, maybe a beef jerky, your family might like that. Then think about some vegetables, canned corn or peas.
Tell us a little bit about the kinds of populations that you serve with the food that you keep.
Well, primarily our number one customer are children, and then our secondary customer are senior citizens. We serve people who are homeless, people who are unable to get out and to pick up food or to carry food in the community. And we're working very hard to increase our home deliveries to people out in the community as well. And I think that's where it might get interesting in the event of a pandemic.
You need to use transportation. Your children need to go to school. So during a pandemic, we may not want to get on the bus. We may not use our typical modes of transportation because we're concerned about getting close to people. So tell us a little bit about some alternative approaches.
Well, the first thing that comes to mind is obviously walking. Cycling as an alternate form of transportation can be a good choice for a lot of people who are trying to avoid crowded situations, such as maybe sitting on BART or maybe sitting on AC Transit where the guy next to you might be coughing.
I'm concerned. During a pandemic, I might be putting myself at risk by getting into public transportation. What are some of the considerations that BART has taken to try to mitigate that risk?
Well, first of all, what we're trying to do is make BART cleaner. The other thing we're going to do is offer our passengers a way to be able to improve their own hygiene. That'll be anything from perhaps giving out some sort of handy wipes or maybe some waterless stations where you can go and put your hand underneath there and get some gel that'll disinfect your hands before you go through the fare gates or after you go through the fare gates.
Besides gloving, they're very particular about washing hands immediately after removing gloves. Washing hands with a particular solution that OSHA approves that they have in a foam dispenser in the back of the ambulance.
This is an ongoing discussion, and it's a preliminary discussion because we're just starting in schools to think about these issues, thanks to you. But we all know it's important, and I think the issue of wellness as a prevention strategy is very, very important. What does that mean? It means that we emphasize with all children, particularly our youngest children, that there are healthy habits. Cough and sneeze into your elbow instead of into your hands. Wash your hands. We have to make sure that the schools have the supplies that they need in terms of soap and towels and tissues. And finally, we have to reinforce the policies that already are on the books. Don't come to school sick. Don't send your child to school sick.
If we have a nurse at the school, and it's always a wonderful advantage for all students to have a nurse at the school, particularly when it comes to contagious diseases, because the nurse is the first person who can identify early signs and say, this child does need to be sent home, rather than sending a child back to the classroom because, well, I don't know what to do, or I can't reach the parents, or I don't know who to call.
What do you anticipate would be some of the challenges in communicating all the different shifts in the program to accommodate the emergency?
Our staff would have the same issues that our families having with the school closures, and some of them would not be able to leave their children at home. The public health department would work with our staff to create a plan to get coverage for child care during this time so that the staff are available to continue services.
And finally, many of us need to get health care.
If you're ill or concerned about being infected by other people that might be waiting for their prescription, pick it up at the drive-in and you can be on your way without that kind of exposure. So there's a number of ways that both community and chain store pharmacies as well as mail order can provide those services.
What kinds of things might a staff member be asking you as the medical director? What is my risk?
Yeah. Certainly we give them as much information as possible about the transmission and the types of patients who are coming in and what their clinical signs and symptoms might be. We also make sure that there are Kleenex boxes around, because something as simple as covering your cough or giving the patient who's in front of you a tissue will be helpful in decreasing transmission. We help to tighten up our triage protocols so that when patients are coming in, we could identify them right away and be able to engage a special protocol for them to come and avoid the waiting room. And it really gave them a sense of empowerment that they could do something in order to help with this epidemic.
Well, I think the experience that we have had setting up these clinics has given us a number of different ways in which the material that we use can help us during pandemic flu. One of the things that we have, as you have said, great experience doing is running mass clinics where we manage the flow of many, many people in a very orderly fashion. We've gotten accustomed to working with community volunteers, student nurses, and retired nurses, which would be of great help during a pandemic. We managed to transport the vaccine and maintain the cold chain integrity with the vaccine, which is very important because you want to make sure that the vaccine that's delivered to the patient is viable vaccine.
Now let's go to Dr. Bob and talk about some of the themes, the recurrent themes that have played out in these 4 shows. Bob, what do you have to say?
Thanks, Tony. The one thing that I think we absolutely need to reinforce is that influenza, be it pandemic or the annual variety, is spread by the respiratory route, and the single most important thing that each and every one of us can do is pay attention to our own personal hygiene. Cover our coughs, wash our hands frequently, and if you're sick, don't go to work because you'll give it to somebody else.
Some masks are works of art, others are for fun.
Some masks protect you, others protect those around you.
Airborne droplets from your cough or sneeze can expose others to influenza.
Use tissues to cover your cough, and if a flu pandemic arrives, please cover your cough with a mask.
For more information about pandemic flu, visit pandemicflu.gov or acphd.org. Brought to you by the Alameda County Public Health Department.
Between the ages of 1 and 4 years, the most likely cause of death to children will be an injury that took place at a home. Fewer than half the houses out there with kids are child-proofed. And what we've come to know is that many of the same injuries keep taking place, and there are measures available to prevent those injuries. What has emerged is a health disparity. We find that injuries are 4 times as frequent in children in low-income families.
The good news is that there are several things we can do to lower the risk of falling as we age. There are things we do on an everyday basis that put us at risk, and generally those are habits. We get in a habit of hurrying when we walk, and that puts us at risk. We get in a habit of carrying things in front of us, so now we are walking and can't see where we're putting our feet, so that puts us at risk. Even the way we get dressed in the morning. Do you stand up and put your pants on in the morning?
I couldn't tell you, I don't know.
Are you still asleep when you're dressing in the
Pretty
morning?
much.
That would raise your risk of falling.
To go into poor communities that are struggling day to day and tell them about the terrible things that are way worse than what they had ever imagined, it really didn't work. So we make it real by making it very positive. And we've taken the attitude that we're not preparing a community for disasters, we're actually preparing them to prosper. Building their resilience, building their capacity to be critical thinkers, knowing how to communicate with each other, knowing how to mobilize their assets, and by making it positive and immediately relevant, it means that more people are willing to engage and really follow the steps that we are sharing with them.
There's been one concept thrown around, and it's called the Joint Information Center, or also known as a JIC.
Let's see what a JIC looks like.
We had a Joint Information Center drill, which was held in February of 2007. And the idea is that during an emergency or disaster, the information that comes out to the public has to be consistent, has to be accurate, and has to be timely. And it also has to take into account information coming from a number of different places. And so what you're going to see is an exercise that we did with Camp Parks, which is a federal agency, how we worked with them in order to help us provide vaccinations, mock vaccinations to their population that reside on the base.
The idea that the county had was to push a vaccine, in this particular scenario, the avian influenza pandemic, to Camp Parks. The first time it's been done with the military and Alameda County, and the first time any of us here have been involved in this type of training exercise. And we see it as an opportunity to plan to save lives.
Actually, the average American eats 175 pounds of sugar a year.
175 pounds of sugar a year?
Right, which is about a half a pound a day. So this is a half a pound of sugar. It's 64 teaspoons of sugar. And that's what the average person is consuming every day. This is a 20-ounce container of a beverage, and the label, and I've already done the math for you, tells us that it contains 17 teaspoons of sugar.
Wow.
So I want you to put 17 teaspoons of sugar into this bottle so we can see what that looks like.
Right now, right here?
Right, and I'll help you count.
Give our viewers a sense of what we're dealing with.
Well, tuberculosis is an infectious disease. Unlike the flu or a cold, it's not quite as contagious as those because it's only breathed in the air. Once a person breathes in the germs, their body may contain the infection.
It goes into my body and it can stay there for a while. When you say contain, you mean I can control it in my body for a while. What's a typical length of time that somebody will control that kind of infection in their body?
Well, it varies with the health of the person, with their immune system.
Mm-hmm.
A person with a healthy immune system throughout their lifetime may never develop active TB disease. They run about a 10% chance over their lifetime.
10% chance?
Yes. Okay. But when TB can become active is when a person has other illnesses that affect their immune system, such as HIV, such as diabetes, other immune compromising diseases. Or just the aging process, stress, anything that affects your immune system can allow those bacteria that were once contained but still alive to become active, cause disease, can cause disease either in the lungs or actually any part of the body.
Tayo po ay mayroong gamot para sa tuberculosis. Importante po na tayo magpatangin kung tayo po ay may sakit na ubo. So gonna put this small one down here.
It's very important that a TB skin test be placed correctly, and it must make a bubble. It must make a bump that is visible, and the bump remains for about an hour or so, and then it goes away. And then what we will be doing is in the next 2 to 3 days, reading it for swelling and measuring it if there is swelling, and then referring the person if that is indicated.
Well, Bob, you did a good job. Okay, I'll be back in 3 days to read your arm. Okay, but just do one thing for me. I don't want you to scratch this area or rub it.
Not all forms of life are visible, at least to the naked human eye. Some of these microscopic life forms are helpful. Others cause harm. The following looks at one of the more harmful. This time, it happened in Alameda, California, close to homes, schools, and businesses, near the young and old. The victim was a lesser goldfinch. The killer was unimpressed by the bird's flight, unmoved by its sweet song. The strength of the killer overwhelmed the bird's defenses. It left the bird with wings too weak to fly, a throat too crippled to sing. But in death, it whispered the name of its killer, and science was listening. The killer was identified. It was the West Nile virus. West Nile virus is a mosquito-borne disease, common in Africa, West Asia, the Middle East, and more recently, found in North America.
And that's one of the major problems with HIV, is that many of the people who have it don't know that they have it because they have no symptoms. And yet, because they don't know they have it, they're at risk for spreading it to others.
So how are you at the East Bay AIDS Center? How has the way you approach HIV changed over the years?
Well, the East Bay AIDS Center at Alta Bates Summit Medical Center, we're the largest HIV clinic in the East Bay, currently serving 1,300 people living with HIV/AIDS. We started as a small program in 1986 that served mainly gay men, and at that time mainly white gay men, but over time our clinic has grown significantly, and now we serve predominantly African Americans. A third of our patients are women. Many people are surprised by that, but the epidemic is not just a gay man's disease anymore. It really is progressing into the general community. And particularly in communities like ours, which are very diverse, African Americans are at increased risk. And the HIV test itself can be done with an oral swab that doesn't even require a needle stick.
And how quick can you get results from that?
Within 20 minutes, just like a rapid strep test or a rapid pregnancy test.
Wow.
It's very quick and easy.
Wow, that's exciting. So people can literally go in, get a swab, and within 20 minutes know their HIV status.
That's exactly right.
Watching a reality show, 1 hour. Watching a baseball game, 3 hours. Getting the results of an HIV test, 20 minutes. 1 in 4 Americans infected with HIV don't know it. Learn your HIV status in 20 minutes with the new oral swab screening test. Take the time to take the test.
Plan at least 1 month ahead of time to get yourself not only in good shape, but to acclimatize to the heat. Now, during the hot environment, there are some critically important things. You know, a human exercising, as we just saw there, is generating heat. Heat, in many ways, is a waste product. It's much like the CO2 that we breathe. So we have to be able to get rid of heat. And our body has ways of doing that quite effectively. We send blood to our skin. We also sweat. And sweating is an incredibly effective way of keeping our body cool. But as I hope you can appreciate, when you're sweating, you're losing water. So the indicators for heat stroke are really a significant altered mental status. Somebody hallucinating, staggering, not able to walk a straight line, even collapsing, and worse yet, even developing full seizure activity in a hot environment. That is a life-threatening emergency which needs rapid intervention. Whatever you can do in the field, of course call 911, have them on way, but whatever you can do to cool them down right there on the spot may save their life. If you can just sprinkle water on them and fan them, that's better than nothing. Better yet, get them into a cold shower, certainly out of the environment.
Take frequent showers, and they need not be cold. Just room temperature water is fine. This method is very effective at lowering the body's temperature. Regular ingestion of fluids is a very good way to maintain the body's regulation of heat. And a rule of thumb would be to use one of the sports drinks, like Gatorade, but to dilute it, because most of those sports drinks have a little bit too much sugar that is needed to maintain a regulation of heat. Fans are a very effective method, and just everyday clothing to ensure that our clothing is not too tight but is loose fitting.
So in summary, heat exhaustion, inconvenient, stop, fix. Heat stroke, life-threatening, you have to treat it right then and there.
Did you find that there was something missing in your traditional Western medical training that integrative medicine would allow you perhaps to offer to your patients?
Yeah, that's a good way to put it. I think no system has a monopoly on health or on healing. And allopathic medicine, conventional medicine, Western medicine, whatever you want to call it, is a powerful approach. But there are certain things that we haven't done as well, such as nutrition, or how to handle pain, or certain mental health conditions.
The acupuncture means use the needle to insert certain points. These points, we need to learn that certain points to do physical stimulation and cause body have some response, means called a qi energy response, to get some the chemical exchange to fix your problem on. No any other external things to help.
One in the forehead called yin tong, which helps the lungs expand, also helps the body to release endorphins. You can look straight ahead now. And this one called shun man, which means spirit gate in Chinese. It also helps endorphins to be released in the body. That one's called sympathetic nerve, which helps your body to relax without using drugs or alcohol. and then a point that's called the 0 point or the balance point, because that's what we're trying to do.
But herbal medicine, such as nutrition supplement, they just balance your yin and yang, such as some people feel really hot, thirsty, feel restlessness, very anxious, and we use some balance and calm down, and herbs calm down. But some people feel very cold, extremities cold, and the body is cold. We try to use some warm conditioned herbs to heat up, to warm.
What are some of the herbs you use the most here?
The licorice root.
Yeah.
Tastes very good, sweet. This one.
What's
Angelica, Dongguai, the very important female herb.
Where do the herb come from?
Most of them they import from mainland China, except those from Wisconsin, American ginseng.
What kind of the medical problems do this herb treat?
This for help the circulation, release the pain, and good for itching.
The truck driving system at the Port of Oakland is broken. It's failing the community and it's failing the drivers. A lot has been said about the public health problems related to port trucking and the pollution.
These toxics are killing us. They're killing our children, and the children are our future. We don't need this.
Since your average driver in Oakland spends about 2 hours a day waiting in line, their trucks are inching forward, and that whole time they're belching out dirty diesel smoke. The drivers are breathing it, and it's going into West Oakland, where 1 in 5 kids have asthma.
Some children have to carry their little asthma machines with them.
For the first time, people are starting to look at the problems that the drivers face, and we've come to understand the only way you're going to be able to solve the public health problems is by dealing with the issues of the truck drivers.
The port wants to put a Band-Aid on it. That's not the solution.
And they're hired as independent contractors, not as employees, so they don't get paid by the hour. They're not salaried, they get paid by the load. And what that means for your average truck driver in Oakland is they're working 11 to 14 hours a day. They have no benefits, they have no insurance, they have no workers' compensation, and at the end of the day, they're making as little as $8 an hour.
To maintain these trucks, it takes a lot of money, especially when we spend all those hours in line without getting paid. It's very tough.
And what do you have for your children and your grandchildren except your legacy of West Oakland? You want them to be able to live healthy lives. They're not.